Good morning, everyone. Happy Monday. My name is Sarah Anstein. I'm the Director of Partnership and Outreach at the OneOhio Recovery Foundation. Thank you for joining us for our fourth Impact Academy on meeting the evidence-based requirement. So we're really excited. We have a great lineup for you this morning, as I'm sure you are all preparing your grant applications and want to make sure you nail that evidence-based requirement. So to support organizations as they gear up to apply for funds to the foundation, we have launched the Impact Academy. In partnership with experts from around the state, the webinar series provides free webinars to highlight examples of programs and services that align with the foundation's abatement strategies and will help you identify and incorporate evidence-based requirement into your grant application. As always, we record the webinar and we'll post the recording and the PowerPoint on our website. So if you missed our previous 3 Impact Academy webinars, those are all on our website as well. So we will do the same with this. We'll post the recording and the slides up on our website this week. So we will get started talking about evidence-based. So as always, please follow us on social media, sign up for email updates if you haven't already. And throughout this, if you have any questions, you can email us at info@oneohiofoundation.com. We've got a lot of great content on our website, but you're here today, so you might already know that. But if you have friends or colleagues that weren't able to join us, please send them to our website. All of this information is there. And today we are talking about the evidence-based requirement of the foundation's funding. And the expert panel is really who does that thorough review when we go through the application review process. So that expert panel reviews after the regions review and recommend. And the expert panel is looking to ensure that the recommended grant proposals align with the evidence-based requirement and that they are consistent with the abatement strategies. So does it have an evidence base to it, and does it align with one of the abatement strategies? That is what the expert panel is looking for. These are our incredible expert panel members. You can read about them on our website. We have their bios. They come from all over the state. They have a really diverse range of experiences, backgrounds, education, expertise. So pretty much anything you can think of, they've probably got some experience and expertise in it. So we're really lucky to have them helping review the evidence-based summaries of all of your grant applications to, again, ensure that the grants that the foundation awards are supported by evidence and align with one of the abatement strategies. And I'm really excited this morning because we have one of our expert panel members, Stephanie Robinson, here with us today to walk through the questions on the application about evidence-based. So Stephanie, I'll turn it over to you.
Thanks, Sarah. My name is Stephanie Robinson. I am a member of the expert panel, also a person in long-term recovery. So for me, that means I haven't used drugs, alcohol, or engaged in eating disorder behaviors for over 15 years. And just really excited to be here to talk about evidence-based practice and the evidence-based requirement for the application. And if you're feeling overwhelmed or you're feeling a little bit disconnected from this evidence-based piece, today's going to be a great education to take a deep dive into what we're asking for. And trust me, most of you are already doing this, and most of your applications are going to be based in this. So this is just going to really help you guide you through the application. Sarah, you want to move the slide? So on our website, what you're going to find on the OneOhio website is that the expert panel and the OneOhio staff has really done some amazing work over the past few months. And we have these quick guides to meeting the evidence-based requirement. So everything is really laid out for you on the website. So there's these 2 resources. The one is just really, what does this mean, right? What does evidence-based mean? And our experts today are going to take a deep dive into that as well. And why do we need this? Because part of the MOU is that the programs have to be evidence-based. So, and they have to align with the abatement strategies. So those are the two like major pillars that you need to make sure your application meets. And how are you going to do that, right? So there's these different types of evidence. They're going to review these today, but this is a quick reference guide for you to check where you're going to line up in your application. And then I've gotten this question. I know a lot of people have, well, where do I find the examples, right? Where do I find this? And we've put together a list of resources for you. This is non-exhaustive, so this is just a snapshot because we are lucky. There is a ton of evidence-based research that is available to you. But these are some places that you can start navigating that research. So these are going to be things that you want to print off, you want to have as reference guides when you're doing your application, and they're going to really be supportive in your process. Next slide. Here's what it's going to look like. These questions are also they're on the website, they're in the grant portal. So what are we going to ask? There's no surprises. That's the best part about this whole thing, right? It's fully transparent. So how would you describe the evidence base of your proposed project or program? There's those, those types that we have in the last slide. So you can see that they line up right there. So you're going to choose one of those types, and then you're just going to be asked to upload a document summarizing the research supporting the evidence base of your proposed project or program. So this is just going to be a document that you create that has your references. And again, the experts that are going to speak after me are going to get into what's going to look like. But this is just where you're going to document that out. It's going to be one page, and then you're going to upload that into the grant portal. That is what the expert panel is going to use to be able to review. So that is where you're really going to show, here's what we're proposing, and here's the evidence base that supports that proposal. If you select innovation, you'll also upload a document summarizing what evidence supports your innovation. So even if it's new, it still is going to have a foundation that has some sort of evidence-based practice underneath of it, so, or supporting it. So either way, these are kind of the paths you're going to take in the grant portal to really show that evidence-based support of your proposal. All right, Sarah, back to you.
Thank you so much, Stephanie. Appreciate you being here. And now I'm going to introduce the Ohio Intervention Operations Core Leadership Team for the Healing Community Study. I will let them talk more about what that was, but now I will turn it over to Dr. Lyons to talk us through frameworks for evaluating, selecting, and proposing evidence-based practices.
Good morning, everybody. Hi, I'm Mike Lyons, an emergency physician at Ohio State, and will be speaking primarily, but appreciate the joint collaboration from Doctors Brown and Winhusen as well, and expect you'll hear from them as we go too. But let's just go ahead and dive in since time is short. Next slide. So these comments are our personal perspective based on our experience in working with interventions in the field, and quite a bit of experience in trying to decide what would make an intervention evidence-based in the context of the Healing Community Study. But this isn't official or specific guidance about this process. Nonetheless, hope it's relevant to you. Next slide. So I imagine most folks have heard of the Healing Communities Study. This was a large NIH-funded investigation working with county coalitions in Ohio to mobilize a broad response to the opioid epidemic. And for that work, we were charged with developing a menu of activities from which county coalitions could choose activities, assisted counties in selecting from that menu, and then helping service agencies to implement whatever interventions were selected. So you could see how that's somewhat similar to this process and why we were happy to be able to speak with you this morning. I did include reference here to that menu that we developed, which is one of the resources that you've been alerted to. Next slide. So the RFP requires us to pick an evidence-based intervention, and that intervention is some advance beyond whatever the current status quo is. And so the what we're going to talk to about with you today about is how would you go about making that case to the review committee? And much of this is probably obvious, but hopefully this is a structured approach that you'll find valuable. Next slide. So extrapolating from the RFP, the idea of evidence-based being multiple peer-reviewed articles or recognition by a state or national agency that would be in a position to have reviewed evidence and make recommendations. And you are aware from the guidance provided how there's different levels of evidentiary support for different interventions, and that we're talking about the highest level with the terminology evidence-based. Next slide. So the way I think about this is when you're trying to explain to somebody, well, this is evidence-based, generally referring to the type of evidence, the quality of evidence, the amount of evidence, or the degree to which that evidence is relevant to the task at hand. Next slide. So for type of evidence, the guidance provided clearly highlights articles, but certainly endorsement by different agencies would be relevant as well. When thinking about where to locate this content, for instance, well, how many articles are there? Where are they? A few, obviously, search engines and the like are well known to all, but other tricks include looking at the articles that were cited within a work that you found and sort of following that tree in a snowball sampling method where one article leads to another to another. If you can find a well-done review and recent review article or meta-analysis article, that in some ways does your work for you because it's summarizing what's come before then. Certainly, there are publicly available presentations and white papers out there that can alert you to evidence, even if they're not in peer-reviewed journals. Similarly, agency reports or what agencies have chosen to fund can provide guidance. And in addition to government agencies, specialty and society or foundation entities, some of them are large and nationally representative and have put out position or policy statements or recommendations on various aspects that might alert you to arguments about what evidence is out there. Next slide. Quality of evidence. So the idea that a manuscript is peer-reviewed is important. There are aspects, as you know, to different journals or sources in terms of reputation. So, some agencies are larger than others. Some articles may have corresponding expert commentary or editorial. There's certainly journal impact factor. I would caution that one definitive study, particularly from a higher level journal, may be more important than multiple smaller flawed studies, but that's not always the case. So estimating the quality of evidence can be challenging, but that is the degree to which you can assess that is one aspect that can be compelling. Next slide. So tips for assessing quality. There's no one size fits all approach to this, but in general, stronger studies are going to be larger, have a more heterogeneous population, use prospectively collected data, and include control groups, or at least other methods for comparing individuals to each other to try to assign causality. Certainly random group assignment is a gold standard. The idea that the analysis was the primary reason for doing the study or was pre-planned as opposed to something that was thought of after the fact is fairly key. The choice of outcome is important, and longer-term patient-oriented outcomes are more compelling than shorter-term process outcomes. And of course, systematic review and meta-analysis can be quite valuable if they're incorporating articles that were of strong quality beyond that, prior to that point. Okay, next slide. So the quantity of evidence from the RFP, you're pointing to the idea of multiple studies and producing a consistent pattern of results. would emphasize this isn't just a numerical count. There's definitely an aspect of quality that overlays this, as I mentioned before. There's a degree to which consistency is important. So a number of small studies of uncertain methods that are all conflicting with each other, it can really diminish the strength of the evidence, even if there's been quite a bit published about a topic. And certainly representation across multiple disciplines, organizations, time, suggests broader applicability and consensus. Next slide. And then the degree to which the evidence is applicable. So a positive pattern of results on the majority of the population that is in question. Obviously, if this evidence is directly relevant to exactly your setting or population or how you are going to do this, then that's stronger. If you're adapting from this, then the question becomes adapting how far and with what justification and plausibility. Does it make sense that this adaptation wouldn't change the core intervention, or is it really uncertain that the intervention works the same way in the place that you're or the population that you're planning to do it? The other aspects of this are the degree to which your population is applicable to the overall project aims. So in other words, is this a large population or a representative population, or maybe a smaller population, but it's very important and neglected in some way? And I also think that there's a degree to which you want the intervention, even if it's evidence-based, is it evidence-based in terms of affecting an outcome that you care about and that is relevant to this funding priority? So is that a plausible and direct link where it makes sense? Well, if you do this, you can expect to get this, and that matters why. Next slide. So, and that kind of gets us into the idea of selecting an intervention. I would pose two basic questions here. What do we need more of that we don't have, or what do we need more of that we don't currently have? And so that's going to involve describing the gap between the status quo and the desired goal. And more than that, it's about explaining why, among all the options to do something in this space, why is this intervention really the best choice for some reason? Next slide. So this is an example of how you might go about selecting an intervention. We depended on some of these ideas and principles in the healing community study. And really it goes to the why of this intervention. So first, understanding the current landscape and where is the unmet need. Second, identifying the priority population and the best way to access that population. Then considering what are the options, what are the interventions that are available that are relevant to that population, and importantly, that method of accessing that population. And then the final step is arguably the most important, although if you haven't fully considered all the options up to this point, then you may have missed something that might have been important to consider. But once you've selected your list and you're trying to decide what from that list to pick, the idea of comparing expected impact to feasibility, I think is really compelling. And so maybe something is really important and powerful, and yet it's not clear that you can really get it done. Conversely, there's something that's really logical and easy for you to do, but is it truly the highest impact approach that you could take? Clearly, low impact, low feasibilities are maybe not even going to enter your mind in the first place, and high impact, high feasibility interventions, it can be hard to find, since sometimes the most powerful things are also hard to get done. But this framework may be helpful in your considerations, and I think touching on the expected impact and the feasibility of achieving that impact is fairly key to making your case for not only why you should be the one to do this, but why did you select this approach, and why should it outcompete other possible approaches? I think that's the last slide. Is there more? Nope. Okay, well, thank you. Hopefully that was helpful, and good luck to everyone.
No, that was so helpful. Thank you, Stephanie. Thank you, Dr. Lyons, for walking us through that. It looks like we do have some questions that are coming in, so I will stop sharing my screen and we can take some of the questions. So folks that are on the line, please put your question in the chat. This is our chance to really dig into your questions to make sure that you feel confident in summarizing the research that supports your proposed project or program in the grant application. That's that. Okay, our first question, and I think I can take this one. Some of these I know. What if some project components are evidence-based and others are evidence-informed? So you could check multiples in that question about how would you describe the evidence basis of your proposed project or program. Can you select multiple categories? And you cannot select multiple categories on that question in the application. So I would say to just pick one, but then in your summary document, you can, it doesn't, that question, like there's not, no matter which you pick, you'll answer, the same question. They're not kind of being scored like one was better than the other. So just pick one that fits the majority of what you're doing and then talk about the rest in the summary upload that you will fill out. So just pick one and it'll all be good. Got that one. Are subscriptions needed or is there a cost to access sources? And I know for the evidence-based compendium that we created, everything within there is publicly available. So you shouldn't need to pay to access anything in there. But what other folks like to comment on kind of, maybe the paid journal articles or journals, I should say, things like that, or where might be great places to look to find free, some of these free sources?
I can try that one. So there's a few options. Unfortunately, it's not as broad and accessible as one might like. So Google Scholar is a nice search engine. Now, some of those articles are going to be made publicly available either through the funder or because the authors have included an open access option. The other is if you have affiliations with other university partners or those that have access to a number of perhaps those articles that are behind firewalls, that's another option. But the good news is there's a larger set of articles that are available, and starting with someplace like Google Scholar is a nice way to get started with trying to find some of those articles.
And I'll just add to that things that are funded by the government need to be made available after a year or a couple years. So if you're in Google Scholar, which is a great recommendation, underneath it'll have like how many versions there are. So if you click that, a lot of times you can link to a free version if it's been enough time that's passed.
Thank you. Okay, we're getting some great questions in here. I'm up here. If someone else is seeing the Q&A and you want to just jump in, go for it.
I think there's a question in here, Sarah and team, about the infrastructure improvements. And I think that this is a question we get a lot because there may not be an evidence base around purchasing a van, but what you do with that van is what matters. And so how you kind of articulate in your proposal the use of that van, the need of that van is going to be important, and why it will help drive the outcomes of your program, the support for the individuals in your program, I think is going to be a really important element of how you respond to this question.
And there was a question, I scrolled, talking about readiness. You know, for example, you could describe an excellent evidence-based program or intervention, but the target audience is not in a state of readiness to support this lift. Will that be taken into a consider? Or I guess, could you comment on kind of how you balance, you know, the stages of change of who you're proposing to work with, and then what you're proposing to do and how you might bridge that gap, or think about just, you know, the readiness of who you might want to work with and how to maybe describe that.
I'll also just add, I think that that box that Dr. Lyons presented on impact and feasibility is another way one can think about this, that it could be a really high impact intervention, perhaps with strong evidence base, but then, you know, how feasible would that particular intervention be, might be another case you want to make in your proposal potentially.
One thing that we found through HCS is that stigma is a major barrier to things that would be particularly impactful, like medication for opioid use disorder. So if a coalition, agency, whoever you're dealing with is unwilling to go there, they might be willing to do something like Narcan. That there's less stigma, right, attached to that. And one of the things that we found was that agencies that were originally only open to Narcan, once they did the screening, got it all set up, had some success, they're like, oh, well, that wasn't as bad as we thought. Well, maybe we could consider, you know, medication. So success begets success. You know, meet your community where it's at, but just know that this is step number one, and you know, they'll move on down the line eventually.
The other thing I want to add to this question, I'm not sure if this is exactly what they were meaning by it, but it came to mind. Because they gave an example of, you know, bringing a program to a school and the readiness there. If the readiness was also about your partner, right? Like you want to bring a program into a school, but you don't know if the school wants to partner with you. You know, I would make sure that you've got, you know, your partners lined up so that if you get funding, you can immediately kind of deploy the proposed project or program. And there is a spot in the application to talk about your community partners. And if you do already have those agreements or MOUs lined up, talk about it there, because we do want to make sure that funded projects can get started and we're not, you know, that our proposed partners are ready and willing, but certainly understanding that sometimes those we work with do need to, you know, we have to do different things to engage them, and the stages of change, motivational interviewing, all of that. So
I would say at minimum, you need an identified champion in the service agency. One person who's like, yeah, I'm going to help you get this done. If you don't have that, it's probably not going to be successful.
I see a question in here around the interest of funding mental health focus rather than substance use primary services. And I just wanted to put a plug in for our memorandum of understanding. And in it has a list of what it defines approved purposes and then couples that with a list of abatement strategies. What's included, you will find, is a very broad array of behavioral health, family and child welfare, you know, all types of related activities to this epidemic. And so that definition really speaks to substance use disorders, not particularly pointing out opioids, but substance use disorders and co-occurring mental illness, and really understanding the connectedness between the two illnesses, the two diseases is important, but understanding the impact it has on the community as a whole is important, and maybe the impact on mental health. So take a look at that and make sure that you are kind of really reading through that as a supporting document. It is on our website at OneOhioFoundation.com under resources, and as well in the grant RFP and the grant materials. Take a look at that. It does include mental health.
got a good one for us. Some of these I got to really read and think think about. These have been harder questions. So this one asks, can you comment on how or if we should link evidence to the targeted outcomes or measurements section? How we should link evidence to, they're going to fill out an outcomes chart. So how would they link evidence with the outcomes they're proposing to see?
I can start here, and as a concept, I think, you know, two separate sections, but understand the related connection to what you're trying to propose to do, what's the evidence behind it, and then it should then lead to what outcomes you hope to see, is how I've interpreted that. But I'd love to hear from the Healing Communities team when you thought about maybe outcomes in the Healing Community study outside of perhaps this application in particular. What are some of the things that you think about when you kind of connect the evidence to what you expect to see and as it relates to an outcome?
It's a good question. I don't know if I have a great answer, but I'll offer a couple observations. One is there's evidence about the intervention, but then there's evidence about the outcomes of that intervention, and you need it to match, right? I mean, you can do an evidence-based intervention, but it's evidence-based in terms of achieving an outcome that's different than the outcome you're hoping to achieve, then it's not relevant anymore. So if you were trying to talk about the evidence justification, you would want to justify both aspects, both the intervention and the outcome. The other thing I would say is that, especially as you start to get down the ladder with more tenuous evidence base, the plausibility of the relationship, the causal relationship between the intervention and the outcome really becomes key. Is it believable? And even if there is an evidence base, sometimes if there's no reason to think that that intervention would be associated with that outcome, then it's a higher bar for it's easier to prove a causal relationship when you understand the mechanism by which that relationship occurred. If you have no idea why these two things would be related together, then one of the possibilities is, well, the evidence is just wrong. So also in making that case, well, it's not completely worked out, but it's really plausible that naloxone reverses overdoses. For example, you could point to other related things that are evidence that are relevant, maybe not directly or completely relevant, but relevant. But yes, this is the crux of the challenge, right?
And then the other thing I like to think about is how temporally is the intervention related to the outcome. So, primary prevention of all substance use disorders with younger children and adolescents, for example, one could imagine could have some really powerful outcomes, but those may not be the same outcomes as a naloxone distribution effort, right? And so just making sure that you're also thinking about how proximal these interventions are to the particular outcomes is another way to think about it as well.
I'm seeing another question around innovation. And I think that this is an area, and I know, Stephanie, you kind of touched on this earlier, you have something, you have something different that you're trying in your community, and you think it will work because, and what kind of things go into, what would you all think about when you were thinking about this is new, but it lives on, like, it was created by evidence. It's kind of based in evidence that we need something new here. Can anybody kind of share any thoughts to that innovation piece, to just help folks who may have something that they want to try? And what questions maybe they could ask themselves?
I would be really hesitant about just trying an idea in many contexts, and from my interpretation of this one, that would be, a bit suspect. When we were innovating or allowing for innovation, it typically had to do with things that were already being done in practice, and there was more of a practice-based evidence, a good anecdotal understanding that this was working, even if the research evidence wasn't great. But the idea of just picking something that no one's ever done, just because you think it will work, I imagine a lot of folks would think that's a step too far. Outside of a research study. I mean, that's what research is, right? When you have an idea, you're not sure if it works, and then you test it. But it's true that clinical practice does sometimes advance faster than the research. Sometimes, a doctor will just start doing something, and maybe that catches on, and maybe everybody's doing it. And maybe at some point that starts to feel a little bit like evidence-based, because everyone's doing it, everyone thinks it works. Although we have, so many examples of where when you actually go back and do the research, you find out that this thing you thought was working doesn't work, or doesn't work the way you thought that it does, or doesn't work to the extent that you thought that it did. So I would just say that the undercurrent of the comments I was trying to provide is that the more you get away from strong evidence-based publications, the more tenuous the argument becomes.
And I think what we've seen with innovation, like at the grassroots level, is taking things that already exist and doing them in a different way. So taking already evidence-based practices or programs and doing them in a different way. So not just, oh, we're going to right, the hula hooping, right? We're just going to start hula hooping, right? Things that, but it's using, okay, for us, an example is using, peer support and recovery housing. And so using these things in a different way, in an innovative way. So it's innovative, but it still has that foundation of evidence-based.
Yeah, I agree. That's common. And this won't help with this application process, but I will say that, again, as you start to extrapolate existing evidence or have lower fidelity to employing the evidence, knowingly or unknowingly, things can go off the rails. There's, examples of things that, have worked, you're sure they work, but the way you're doing them, they're actually harmful, unbeknownst to you. I won't go into all those details, but just to say, again, the degree to which you're getting away from the rigorously evaluated prior experience in the peer-reviewed literature is the degree to which things get more tenuous.
Wondering if we could talk a little bit about practice-based evidence, because that is one of the options that folks can select. And, I think a lot about the recovery space and, the kind of in the world of recovery supports, which is one of our abatement strategies. That field hasn't had a lot of funding to study, what we know, but obviously, speaking from experience, we know how to help people enter and sustain long-term recovery. We just can't always, we haven't had the money to research it. So talk to us a little bit about, the value of practice-based evidence. Like, we see this, maybe we do our own kind of tracking outcomes, we see it on a day-to-day basis. And for some of those spaces in our field where there just hasn't been a lot of research to kind of get to that high level, peer reviewed, it's been done multiple times level. So Dr. Brown, I saw you came off mute. So
yeah, I think presenting what evidence is out there and commenting on the nature of the evidence would be an important starting point. And then, certainly when you're thinking about practice-based evidence, that could take different forms. But, providing some evidence here too that's collected in a systematic way, I think becomes really important. For example, if you're making the case that your peer recovery support is associated program with greater retention and engagement in a substance use treatment program, for example, one might want to present evidence about how many patients you've served through this approach. Maybe there's some changes over time before the model was implemented and after. And so finding ways to present data that have been collected systematically to make that case along with commenting on the existing evidence base and where that's at, I think would be important if you're dealing with a strategy that's more practice-based evidence.
I think there's also a bit of a relative merit question here. So in other words, there's the absolute justification for a given strategy, and then there's the justification for that relative to whatever the other available option is, right? And so if you're in a situation where we obviously we've demonstrated the need, folks need this, and the only way we know to do it is this way, right? I mean, there is no other alternative. And that's a different situation than, maybe there's 3 different ways to go about it, and some of them have a stronger evidence base than others.
Looking through, we got one question about evidence-based. I think there's, the evidence-based programs that are on the big registries, right? And we allow for kind of that, highest kind of level as one of the options. But then we also allow for, the promising practices, the practice informed. So the question was about, are you saying that if there are peer-reviewed studies that show that the type of program we're doing, even if it isn't on a registry, could be considered an evidence-based practice as you define it? And I know kind of evidence-based practice is its own kind of thing, right? That lives on registries, but then there's kind of the broader evidence base. So can anyone add any more color commentary to that?
This probably sounds too vague to be helpful, but I would again point to context and the relative merits question, right? Given this setting, given this need, given the options that are practically available, what is the greatest expected impact? And so could you be in a situation where something that's evidence-based is just not feasible, but you could do this other thing that probably would work, but it is feasible? You can imagine those trade-offs. And it'd be nice if there was sort of like just a very clear one-size-fits-all way to do this, but I just don't think there is. I think it's about the local unmet need, the justification of the desired outcome, and then assessing the relative merit of the different options compared with one another, based not just on the strength of evidence, but also based on the impact and feasibility balance.
Could we talk a little bit about what peer-reviewed means?
Can do that one. So peer-reviewed means typically that if you're submitting a journal article, you, for example, then get assigned experts in the field that are knowledgeable about a topic. And oftentimes you go through a series of back and forths to either improve that manuscript, or in many cases, the peer reviewers will decide it's not quite at the caliber for a particular journal to accept. And so, there's different journals with different standards as far as they're peer reviewed. But the idea behind peer review is that this has been vetted by people that are expert in the field, both for the methodology, but also for the content, so that you hope when that publication comes out, it's a more rigorous process than had you just posted it online without anybody who has expertise reviewing it. So that's the goal. And then some of the evidence-based practices will also go through a peer review process, and different agencies will have ways for doing that. So that's another slightly different process, of course, but another way that peer review comes into play.
And I would acknowledge that just because we value peer review doesn't mean peer review is always good. Sometimes it's not, but there isn't a great alternative. And it is extremely common that through the peer review process, work actually improves in quality and clarity before it's disseminated. So I think we're stuck with peer review until we invent something better.
And I do want to say, kind of looking at some of the questions, you know, all the folks involved in the review of these grant applications are not looking at this to say, oh, you checked promising practice and that was the wrong box. It's really, you know, practice and form. We're not looking to do that. We've provided some definitions of what we think those terms mean. Pick the one that you best think fits the majority of what you're proposing, and really focus on the summary document that you upload. The expert panel wants to see you summarize the evidence that supports what you're planning to do if you get the money. Evidence supporting what you plan to do, you know, who you plan to do it to and with, right? Like we talked about kind of the target population. You know, I think about, you know, taking something that we know works for adults, and now I'm going to try to do it with adolescents. Is there research to support that? Maybe, maybe not, right? Think about the target population, what research, you know, exists for who you try to do, and then, you know, the related outcomes. Does the research support what you're planning to see as the change, the impact, you know? That's really what we're looking for. Summarize your understanding of the research that supports what you're planning to do. So I wouldn't get too hung up on which box to check. You know, pick the one that you best think fits the research that you have. So I'd maybe start in reverse, start kind of drafting your summary document. And then when you look at all the sources that you had available, which of those kind of best fit? If it's more that you have a bunch of, you know, maybe you've done a program evaluation, you've spent the money to have someone evaluate what you're doing, and that's what you're going with, include some of that as your evidence. You know, why do you think what you're doing works? If you check, you know, innovation, for example, what leads you to believe this is going to have the impact that you say it does? What are you seeing? I know we've had a lot of great questions from, you know, a lot of grassroots nonprofits that I think this is, you know, they've been doing great work for a long time and this might be new to them. You know, tell us about, what are you seeing? How do you know what you're doing works? You know, what do you put in your annual report to, you know, communicate to the world why your organization's important, and the impact that you have? So I know we're all kind of coming at this from different places because so many great partners were able to kind of come into this process with us. So for what that's worth, I wouldn't get too caught up on which box to check. Pick one that you best think fits, and then really summarize your understanding of the research that justifies why you should get the money, that you're going to have, you know, the biggest bang for your buck in terms of helping Ohioans, you know, enter and sustain recovery, reduce the prevalence of the opioid epidemic, that sort of thing. So I know we've got a few minutes left. I don't know if other folks have seen questions in the Q&A that you feel like, oh, that's a good one, let me take it.
I know that there's some questions in the Q&A that really speak to specific things within your application. We are limited to what we can say on the line here today. But I think Sarah just gave really great advice on how to think about this, what to think about, but in particular things around how you should partner, who you should partner with, and how you should do this application. Because it's a competitive process, we're limited to answering those questions, but keep other questions coming.
Well, a question for the Healing Communities Study team. Could you walk through an example of picking, you know, a high impact I can't remember the other term, like a evidence-based program, what one of those would look like, how you pick it, and how you knew where to deploy it, like what setting, what target population. Could you just talk through an example of one?
John, I don't know if you have something in mind, and this is the kind of thing where lots of examples might be useful because each example is sort of unique. I'll offer up the example of naloxone distribution. We all think that works and we're all fans, right? But do we know? You give someone naloxone and they survive, that doesn't necessarily mean they survive because of the naloxone. We don't have randomized controlled trials that of one community versus another with naloxone showing changes in overdose rate. And even if we did, we wouldn't know what other factors contributed to that. A lot of times we don't even know when naloxone's used. We don't know how much of the naloxone we give out that gets used. We don't know how much to give out or where to give it out. We actually don't know very much about naloxone at all. But we have a plausible mechanism for how it reverses overdose, as we know in medical settings, at least, that it does do that. We know that there's nothing all that complicated about giving it. So there's every reason to expect that if an overdose is witnessed, and somebody has naloxone, and it's enough naloxone and they give it, that might make a difference. So, call it evidence-based or evidence-informed or whatever you want to call it, but those are the kinds of things that you struggle with when you're trying to say, are we ready as a matter of public policy to throw a lot of money behind naloxone? Obviously, our experts and expert bodies have decided yes. The strength of the true published evidence behind it, other than just descriptions of having done it, is honestly leaves a lot of questions unanswered. That's what defies giving a clear answer to what exactly is evidence-based, is because it's a bunch of factors that go into deciding amongst the available alternatives. And when is a threshold met to the point where you're willing to support something? I don't have a way to define that. I think that what it really comes down to is you have a certain amount of resources and you competitively judge among the available options, and that's what wins.
So I guess in terms of judging kind of likely impact versus feasibility, one thing that we often ran into was stigma, right? So we know, so there are 3 medications, to treat opioid use disorder. The evidence is the strongest. If you want to reduce overdoses and deaths, probably the strongest evidence is for methadone, but that's where stigma is the highest. So communities, and starting a methadone program from scratch is extremely difficult. So that's low in feasibility, right? So a lot of the communities tended to pick buprenorphine, right? Because that's also very effective in reducing opioid overdoses. Some communities didn't want to do that. They wanted to do, extended release naltrexone, because that's an opioid antagonist. So there's less stigma, but the evidence base isn't really out there yet to suggest that it reduces overdoses. So that's an example where many of the communities, in terms of likely impact versus feasibility, ended up with buprenorphine, right? That's kind of a sweet spot in those things. It's actually easier to implement in different settings. One working example, but many of the communities in Ohio and HCS, did some kind of buprenorphine. Now, but where do you do that? If it were up to me, every jail would be offering buprenorphine in Ohio, because we know that's going to have a huge impact. Some jails, they don't want to do that, right? There's a lot of stigma attached. So then you kind of go to the next setting, and really what you want to do is target your intervention where you're going to reach the highest risk population, right? So people who have lost their tolerance, for opioids, people who've had a previous opioid overdose death. We did a lot of EMS leave behind, making sure kits were in the hands of bystanders and family members, right? Friends. So when there's another overdose, you can reverse it. So really that's what you need to think about in terms of the probability of reaching really high risk people in a given venue, and that venue's willingness to actually partner with you to implement Narcan, or better yet, medication, like starting buprenorphine in the ED and linking them to ongoing care. That's another great intervention. So just a mix of, what the impact is and what the venue is willing to partner with you with.
Partnership is definitely key in a lot of these. So we made sure you could talk all about your partnerships, collaborations, and community involvement in the application. So I think one of my big takeaways from this is that all these things go together. Who you plan to do it with, who you plan to serve, your outcomes, the evidence, it all fits. So as you're working on your applications, and Stephanie mentioned it earlier, the application question set is on the grants page of the foundation's website. If you go into the grant portal, you can print blank and see it in like a 30-page version of it. So really look at your application holistically, make sure all of this stuff goes together. I thought this was incredible. Folks had a lot of really good questions. As always, the slides will be on our website along with the recording of this. And, I think you'll be seeing more of us doing these types of webinars, because I've been really encouraged that so many folks want to know more. They feel, in their, heart of hearts, what they're doing is working and has an impact. And I think folks are now kind of getting curious to see, well, how can I prove that? How can I evaluate my program? And so I think we'll see lots of interest in wanting to do program evaluation and talk more about research and, how do we use what's already out there here in Ohio, so that we know that with all of the dollars we have, that we're putting it towards the things that are gonna help us see the impact and the outcomes to make a difference in the lives of our fellow Ohioans. So we are at time, so I want to thank you all so much. Thank you to our incredible panelists for joining us, presenting, answering questions. Y'all did a great job. I know this is a hard topic. It's like going back to school on a Monday morning, so I appreciate all of you for being with us. I know I learned a lot. And as always, email us, apply@oneohiofoundation.com if you have a question about the grant application process. And we will see you all next time. Thank you all so much.